Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the government formally kicks off its vaccine rollout after the arrival of Sinovac vaccines from China. The president says he may loosen restrictions in Metro Manila if the country is able to get a stock of 2 million vaccines. And authorities say a global supply problem caused the delay in the delivery of over 500,000 doses of AstraZeneca vaccines. Food and Drug Administration Chief Domingo and World Health Organization Philippines Representative Dr. Rabindra Abeyasinghe join us live. Health authorities find 6 cases of the COVID-19 variant first detected in South Africa. Of the 6 cases of the more transmissible B1351 variant, 3 are residents of Pasay City. 2 others are returning overseas Filipinos from the United Arab Emirates and Qatar. The health department has yet to verify if the 6th case is a local one or an OFW. The Philippine Genome Center also detected 30 additional cases of the B117 variant first detected in the UK. Most of them are returning overseas Filipinos from the Middle East, Singapore, and the US. This brings the total UK variant cases in the country to 87. Latest sequencing results also found 2 more cases of mutations in Central Visayas, bringing the total to 34. With the ongoing vaccine rollout, vaccine czar Carlito Galvez says there has been an increasing demand for China's Sinovac vaccines. He says he received calls from local governments expressing interest to secure supplies for their health workers after key personalities got vaccinated. Galvez adds a private hospital, St. Luke's Medical Center, is also asking for 5,000 doses for their medical frontliners. Galvez assures there will be equitable distribution of vaccines across the nation starting March 3. Let's go straight to the source of the story. First off, Food and Drug Administration Director General Domingo. DG, it's been almost 24 hours. Siyempre, yung tanong ng lahat, kamusta na po kayo? Meron ho ba kayong nararamdaman na kakaiba?
Yeah, hi Pinky. Yeah, no, I feel fine, no? Hindi nga masakit yung braso ko. I did not get any fever or signs and symptoms. Well, I know I'm not yet protected. My antibodies are just building up. But generally, I feel well and I feel asymptomatic.
Opo, that's good, no? But when you say that you're still building your antibodies, does that mean that possibly in 3 days or 1 week, dun nyo po posibleng maramdaman yung side effects ng Sinovac vaccine?
Well, no, usually you get the side effects within 24 to 48 hours, no? And then, of course, you will slowly build up your immunity. On the second dose, then that's the possibility na you might get some symptoms na or sometimes worse symptoms kasi nga medyo meron ka ng konting panlaban yung body mo. No? But for me, the first dose went very uneventfully.
You know, I remember Secretary Vince Dizon was saying, we spoke to him yesterday, must have been 2 hours after he was vaccinated. Sabi niya, mas masakit pa daw yung flu shot or mas naramdaman pa daw niya yung flu shot kaysa dito sa Sinovac vaccine.
Yeah, I have to agree, no? Well, first, I think because they used a smaller needle, no? Yung kasing sa flu shot, kung naalala natin yung built-in sa syringe, medyo malaki yung needle nito eh. Okay. So they use a very small needle. The nurse who gave me the injection was very skilled. So walang masakit. Tsaka yung walang pakiramdam na parang malapot or parang mabigat yung vaccine. It's also a very small amount. It's only 0.5 ml.
I see. So, okay, so it's good you're feeling nothing as of now, and your second dose will be on March 28, if I'm not mistaken?
Yes, the schedule is 28 days, 4 weeks after the first.
DG, why were you one of those chosen to be vaccinated?
Well, I'm one of the medical staff of PGH. No? So we all enlisted like a few weeks ago for our vaccination, and then you get called. And then, of course, every time na merong survey, they survey. So sinabihan ako, okay, you're in line. I'm perfect for the vaccine. I'm between 18 and 59. I'm clinically healthy. And I'm not a frontliner. No, I don't treat COVID-19 patients. I'm an ophthalmologist. So relatively low risk naman ako for COVID-19 exposure. So check all the boxes. It is my schedule and I went for it.
And what about Dr. Gap Legaspi? He's not also a frontliner treating directly COVID-19 patients?
Yeah, but I think Gap naman gets more exposure than I do because he's there at the hospital
Yeah.
every day, even on weekends. Ako, I go to PGH now only once or twice a week.
I see.
I would think yung mas mataas naman ang risk ni Gap kesa sa akin.
Okay. DJ, paano yung meron ho kasing, if I'm not mistaken, about 5 individuals from the Veterans Memorial Medical Center who were actually brought to the hospital after being vaccinated. They experienced nausea and other side effects. Is this normal? And anong bang klaseng monitoring system ang dapat gawin?
Yeah, that is really expected. No, I mean, 20-30% of people do get some form of adverse event after an injection, anywhere from pain at the injection site to some dizziness, increased BP. Kasama na rin yung anxiety, kasama na rin yung konting takot siguro nung nabakunahan sila. But as long as they are mild, that's fine. Kaya yung standard procedure natin is that when you get injected, you stay in the hospital, at the injection area for 15 to 30 minutes to see if there's anything that has to be treated immediately.
Pwede rin ho
Pag
talaga,
mild naman, they let them go home.
At pwede rin ho talaga pumasok yung takot. So, let's talk about this. Very important, Director General, kasi po, marami pong nagtatanong ng mga healthcare experts, nasa na ba talaga itong phase 3 clinical trial? Because what they're saying is, this is not published regarding Sinovac. Hence the hesitancy to actually be inoculated. Why? Sila po yung frontliners natin. Sila po yung directly treating COVID-19 patients. You are trained to sift through facts, scientific data, and make a good analysis, a sound analysis, if a vaccine is good enough for you. Let's go to the FDA. The FDA said, okay, we're not recommending it for frontline medical workers directly treating COVID-19 patients and senior citizens. So my question is this, yun ho bang you perused, the one that you analyzed sa FDA na phase 3 clinical trial, is this not available for healthcare experts, doctors?
Well, it's not yet published, so hindi pa siya in public domain. And of course, the manufacturers are saying that they're still preparing the manuscript for it to be published. But we did share it with the experts of the Health Technology Assessment Council and the NITAG, and of course, experts kami yung nag-peer review nung actual papers before we made our decisions. And yung decision namin, of course, kaya medyo cautious siya kasi talagang at this time, with the documentation that we saw, ito lang yung sigurado kami na the vaccine would be very beneficial. Yun yung 18 to 59-year-olds na healthy individuals. And yun nga, parang dun sa mga frontliners, the COVID-19 handlers talaga, medyo mababa yung kanyang efficacy. But the government decided to offer it to them anyway because there's no other vaccine available at this time.
Which becomes a little confusing to me because the narrative from the past, prior to even the FDA granting emergency use authorization, government has always said that basta't dumaan yan sa FDA, kahit na ano pang vaccine yan, basta't sabihin ng FDA na safe yan, efficacious yan, pwedeng gamitin yan, dito tayong maniniwala. So dito na po nangyari yung FDA, sinabi na yes to Sinovac, but not really right now for seniors and frontline health workers directly treating COVID-19 patients. And then that kind of shifted, in my opinion, to the government saying, well, you have the option. Kung gusto nyo, sige, go ahead. Kung di naman, huwag kayong mag-alala, matatanggal kayo sa priority list.
Yeah, what we try to do kasi is, try to look at the nitty-gritty and look at the details of the data that's in front of us and give a more apt description of the product and who it's good for. Like in the same way that kung magkaroon ng Pfizer dito sa atin, hindi siya indicated sa mga people who have a lot of allergies, no? So in this case, talagang yung data na nakita natin, ito yung effect niya, no? Kung ikaw ay frontline health worker, 50% ang efficacy niya. And what we just want to do is give that information. And if you do decide to get that vaccine now instead of waiting for another one that you don't know when it will come, no, you just have to realize that you have to be very extra careful, that you still have to wear your PPEs completely, and even at home practice everything very safely because of the efficacy rate for you is at this level, no? As opposed to other people in the community who will really get a higher benefit from the vaccine.
So the thing is, DG, papaano po mangyayari yung sa mga healthcare, yung mga doktor po that want to peruse, look through the clinical phase 3 trial of Sinovac? Just for the record, this is not available to them right now.
It's not yet publicly available. And we're asking tong manufacturer when they are going to publish it. And I believe they are going to publish it soon because they also applied sa WHO din naman ng EUL. No? So that means even when WHO comes up with a decision, they will probably publish it if they approve it.
Okay.
So yung talagang we just have to wait kasi wala pa siya sa public domain and everything that's submitted right now is submitted in confidence.
So there's a confidentiality agreement there, whatever data you have, because that leads me to my next question. Why couldn't you, the FDA, share that with the doctors?
Ang FDA as a regulator, everything that is submitted to us is confidential. No? In fact, all officers of the FDA, all workers, employees of the FDA, we sign a confidentiality agreement with the government every year. Nire-renew namin yan. Kasi lahat ng pinapakita sa amin, hindi namin yan pwedeng i-divulge sa public because this is private property, it's private information, and it's proprietary to the product. So, halimbawa, yung sinabit ng Pfizer, hindi ko naman pwedeng i-share yan sa AstraZeneca or sa Sinovac kung hindi yan in public domain. So we really are limited by that confidentiality.
So they really have to wait until it's published in medical journals. Ganun po.
Yes, no, and usually in regular times, no, hindi naman tayo din nag-approve ng products na hindi pa completely tapos ang mga clinical trials at hindi published ang mga ito, no. We're just really in very unusual times right now. That's why we are reviewing and evaluating applications even if the reports are not yet published.
Kaya nga po tawag emergency use authorization. So, do you agree that the hesitancy of some healthcare workers to really be vaccinated right now, do you agree that it's prudent for them to somehow wait for these published reports or published phase 3 clinical trial?
Well, yes. No, if you want to get a fully developed product, talagang yun yung natin. No? You wait for it for all the trials to be completed, and then once we understand the product completely, the vaccine, that's when you get the shot. But the thing is that might come, at the earliest, maybe next year, no? Yung talagang fully developed and then licensed product. How much are you willing to wait? No? When what we have now under an emergency use authorization is reasonable data to show that benefit outweighs risk. Yun lang naman ang maipapangako namin. Kaya lang, available na siya ngayon, compared to a product that's fully developed that will be available next year.
Right. Kaya nga sabi po ni Secretary Galvez kahapon, I believe sa PGH, he said, we should not wait, sabi niya po, I don't know if you're gonna agree with this, we should not wait for the so-called best vaccine. He goes on to say there is no best vaccine because the best vaccines are those which are effective and efficient and come early.
Well, yun marami ng tanong niya sa iba-ibang authorities. Sabi nila, what's the best vaccine? And they always say, the best vaccine is the one that's in your arm. The one that is available to you and that you have it injected. Because even if you're looking for the best vaccine and it's not available to you, then it doesn't count. No? And right now, this is the one that's available to us. And you just have to make a decision if you're going to hold out and wait for another.
Siguro yung iba, DG, nihintay din yung AstraZeneca because even Secretary Galvez was saying that possibly it will arrive this coming March. Maybe also that's also the other choice, the choice that they're waiting for. Very quickly, regarding EUAs, I think it was Secretary Harry Roque who said that Sinopharm has already applied for an EUA. When was this, sir? And what's the latest on Sputnik V?
Yeah. So I did have my staff check it now kasi holiday kahapon sa Muntinlupa, araw ng Muntinlupa, and FDA was closed. But they did check and then online yesterday afternoon, an applicant did send an application for EUA for Sinopharm. So they're looking at the documents now to see if complete or if there are any documents that need to be submitted before we officially accept the application. So meron nga dumating daw kahapon. And yung sa Sputnik, our regulators had a meeting with them last week to clearly define what requirements they still lack. No, mostly documentary requirements na yan. And I hope that with the help of the Russian embassy and then the Russian Development Institute, that they get to submit all of these requirements soon. Yun na lang yung mga hinihintay namin.
Mabilis lang po, DG. Pero meron ho ba silang phase 2, just to update us, or phase 3 clinical trials, yung Sputnik V, that are available right now?
Yung Sputnik is actually published. No? The interim phase 3 trial is published in Lancet about a month ago. So the data is actually there, but what we're looking for now is more on the manufacturing side, the quality side, and yung good manufacturing practice ng kanilang factory.
I see. Okay. Food and Drug Administration Director General Eric Domingo. Sir, thank you so much for your time.
Thank you and good morning.
Health Secretary Francisco Duque says the World Health Organization notified them of the delay in the delivery of AstraZeneca vaccines. WHO Philippines representative Dr. Rabindra Abeyasinghe tells us more after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Let's now go straight to the source of the story. We have World Health Organization Philippine representative Dr. Rabindra Abeyasinghe. Dr. Abeyasinghe, welcome to CNN Philippines, and thank you so much for your time. I'm going to start with this. Tell us your reaction on the Philippines finally rolling out its vaccination program yesterday.
Thank you, Pinky, and it's nice to be back. We are very happy that the Philippines has included the COVID-19 vaccines into the tools that are used for COVID-19 control. This is a vitally important component as we deal with this pandemic. And we believe that with the introduction of vaccines and vaccinations of large numbers of people, we will see a decline in severe COVID and hopefully a decline in the deaths, because this is what we know. The vaccines can protect people from severe disease and deaths. So we are happy that the Philippines has launched its vaccination program. And of course, you are aware that WHO, through the COVAX initiative, is also trying to deliver vaccines as early as possible to the Philippines.
And because we started our vaccination program yesterday, certainly there were concerns by health professionals on being vaccinated with Sinovac. So in fact, you have members of the government taking the lead in being vaccinated with this particular brand. Even with, maybe we can say, the low number of turnout of those willing to be vaccinated, do you think that this will somehow ease, or there will be some sort of comfort level or confidence in the public taking or being vaccinated with COVID-19 vaccines?
We are confident that once the public has access to information, the acceptance of vaccines will increase. The issue right now is there is a lot of unknown information to the public. And with that, you would expect that the public is reluctant in some places to accept vaccines. But as we begin to find out more information, and as we share information from other countries that are using vaccination programs, we are confident that public perception will change and the acceptance of vaccines will increase. This is what we have seen in many other countries that also introduced vaccines. When you start off, there is skepticism that is driven largely by unknown facts. But as more and more people are vaccinated and they don't see any severe adverse events, the acceptance of vaccines increases. So we are optimistic that we will see a similar picture in the Philippines.
The thing, though, is there wasn't really this skepticism that you're talking about when the doctors or the healthcare workers thought they were going to get the Pfizer vaccines. That didn't happen. We were expecting it sometime mid-February. So let's talk about Pfizer coming from the COVAX facility. What is the latest there? From what we know, the Philippines had submitted its indemnification agreement. And are we still waiting for a counter offer or any reaction from Pfizer regarding this?
So let me clarify that the Philippines is scheduled to receive both AstraZeneca and Pfizer vaccines through the COVAX facility. The requirements relating to AstraZeneca have been completed, and we believe that now the earlier shipment will be 525,000 doses of AstraZeneca coming through the COVAX facility. Having said that, we are also informed that all requirements that the Philippines was required to meet with regards to Pfizer vaccines have been completed, but access to Pfizer vaccines may be delayed somewhat. So if you look at the position of the healthcare workers and what you alluded to, both Pfizer and AstraZeneca vaccines have completed WHO EUL processes, and so there is more confidence in accepting those vaccines. As regards to Sinovac, this is also still under evaluation. Our regulatory teams are looking at the dossiers provided by the manufacturers. They have, in fact, visited the manufacturing facilities in China, and we believe that we may hear of the decision from WHO to grant EUL within this month.
I see.
So until that information is available, it is understandable that people have some concerns.
Mm-hmm. And so let's talk about that first. AstraZeneca. What we thought was that by Monday, there was supposed to be a delivery of about 525,000 doses. But what happened, I think late Sunday, we were told that there will be a delay. So, Doctor, can you tell us now, when can we expect first the vaccines from AstraZeneca coming from the COVAX facility, and how much?
Yeah, so that's correct. The 525,600 doses are scheduled to be delivered. Monday had been identified as a tentative date. We were looking at how we can accelerate delivery. At a global level now, we are seeing two bottlenecks. The earlier bottleneck we were talking of was the manufacturers unable to meet the manufacturing targets because these are biological processes and they couldn't produce the quantities that they anticipated they could early on. We're now seeing a second bottleneck, and that is the delivery processes, because these vaccines need to be transported, maintaining cold chain requirements, and logistics handlers are having challenges in ensuring large shipments of vaccines across the world. There are 190 countries who have signed on to the COVAX who are anticipating vaccines. And now this is posing a challenge. So although AstraZeneca was tentatively scheduled for Monday, this was not possible. And we now believe that we will hear of a possible date. I don't want to create any expectations till we have a firm date. So when we know of a firm date, and which we believe will be very soon, we will announce that.
So you're saying, and I completely understand, that anytime soon you will be receiving a firm date on when the AstraZeneca doses can or will be delivered. And you don't want to tell us now because, well, for obvious reasons, we expected it Monday and it didn't arrive.
That's correct. My understanding is that the consignments are ready and just the logistics arrangements are being made. So once we have a finalization and a confirmed itinerary for delivery, we will share that information.
Dr. Abeyasinghe, let me clarify that. So this 525,000 is not a supply problem. It's a logistic problem.
Right now, that's what we have been made to understand.
Okay, so we have that secured. We have that
Yes.
525,000 vaccines. It's just a matter of logistical concerns. So
That's correct.
And the logistical concerns, who is in charge of that?
So deliveries are handled through through logistics agents, coordinated through the United Nations International Children's Emergency Fund, UNICEF, and PAHO, depending on which part of the world you are. So for the Philippines, it is being coordinated by UNICEF.
I see. Are you confident, though, that you will have a date by this week?
We could be optimistic.
Okay, so let's move to Pfizer. It seems, and I'm looking at you, it seems that it may happen. You might have an announcement sometime this week. What about Pfizer? Is there still a chance that we might receive the Pfizer vaccines, 117,000, this month?
We believe that there may be an opportunity for the country to receive the Pfizer vaccines before the end of the month, but this is unconfirmed at this point of time.
What percentage are you looking at?
Difficult to say because it's largely with the manufacturer now.
And it's been quite difficult. Okay,
Yes.
Doctor, just one last question. I wanted to find out from you, aside from Pfizer and AstraZeneca, are there other vaccines that the COVAX facility may commit to give or donate to the Philippines?
So the COVAX facility has tentative agreements with Moderna, with Johnson & Johnson, but these are pending WHO EUL status. Once EUL is granted for these vaccines, they will probably be available through the COVAX facility. That's why we anticipate that large bulks of vaccines will be moved to countries with the granting of WHO EUL within the second quarter and third quarter of this year. Production capacity will also increase. So we are optimistic that we will still achieve the promised delivery schedule targets for the Philippines.
But in terms of EUL, which company is next in line with the COVAX facility granting, or the World Health Organization rather, granting an EUL to these vaccine manufacturers? Is it Sinovac? Because you mentioned a while ago.
There are 3 candidate vaccines that are being evaluated currently by the WHO regulatory team. That is the Moderna vaccine, the Sinovac, and Sinopharm vaccine. So EUL status may be granted to these within the next few weeks.
Thank you. World Health Organization Philippine Representative Dr. Rabindra Abeyasinghe. We hope to hear positive news from you in the next couple of days. Thank you for your time.
Thank you, Pinky.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.